Thanks for joining the hearing. Go ahead.
Yeah, thank you, Mr. Chairman. And thanks for holding this hearing. Dr. Bhattacharya, if I could, first of all, am I pronouncing your name right? Is it Bhattacharya?
Just fine, thanks.
Okay, thank you. That's very indulgent of you. I want to ask you about some of the points that you made in your written testimony, which I thought were quite striking, about the challenges of mitigation strategies, particularly mitigation strategies that involve lockdowns, full lockdowns, which of course we experienced in virtually every part of the country, and certainly my home state, earlier this year, and that many have been advocating as a mitigation strategy again now. You write about the data that the consequences of social isolation and deteriorating mental health that is associated with these lockdowns. I was particularly struck by the CDC data that you cite that says, let me get this right, that 1 in 4 young adults seriously considered suicide this past June when much of the country was locked down. That's a really stunning number, and these impacts that you talk about in your testimony are really stunning. So can you speak to the challenges that maybe young people in particular, but all Americans face from lockdowns as a mitigation strategy?
I think lockdowns as a mitigation strategy are a failure of policy imagination, and they have had absolutely devastating effects. Humans are not meant to live in isolation, and that's the main focus of the lockdown strategies. Now, I think there are some folks who are at high risk from this disease. As I said, older people, some people with chronic conditions. And so, for instance, 40% of deaths that happen in nursing homes, there we actually do need to do some sort of isolation, but we have to be careful there as well. There's been a 20% increase in dementia-related deaths in nursing homes, apart from COVID. There's the key failure, I think, is a failure of public health to recognize that there's dangers other than COVID. Heart disease, the psychological distress to young people is devastating. We basically made them feel guilty for doing normal young people things. And as a result, it's had, as you can see, 1 in 4 seriously considered suicide. That number is absolutely shocking. I think it should shock the imagination of everyone listening into thinking creatively about policy alternatives to lockdown. The lockdown should be a very, very last-ditch effort, not the thing that we decide is we should do all the time.
I noticed that now even the World Health Organization, which I have to say is a body in which I place very little trust, and for which, given its conduct in this pandemic, I have very little respect. But nonetheless, even the WHO, I believe, has now said that mass lockdowns as a mitigation strategy they don't recommend them. Quite the contrary, that they think the consequences, some of which you've just outlined from these lockdowns, are devastating.
Yeah, I think there's an estimate that the UN put out in April, actually, I think, saying that there were 130 million people at risk of starvation as a consequence of the economic damage from the epidemic. These are lives. 130 million. That's 2 orders of magnitude more than the number of people who have died from COVID-19. And to not account for that in a policy response, I think, is utterly irresponsible.
Can you talk to me a little bit about some of the other healthcare effects associated with lockdowns and decisions to cancel elective surgeries? I know in my home state of Missouri, many hospitals canceled elective surgeries back in the spring, trying to prepare, based on the data at the time, for what they thought would be an absolutely massive surge. And even now, as we're seeing cases rising quite significantly across the country, and again in my home state, a number of hospitals, as a precaution, have curbed elective surgeries and in some cases delay them, which I totally understand. But help us speak to, if you could, the issues that come with the problem of deferred health care. And when you have, again, especially in a lockdown situation, when you have many tens of thousands of Americans, millions of Americans, maybe deferring what would otherwise be fairly routine healthcare procedures, healthcare visits. What is the cumulative effect of that over weeks and months as it builds up?
We're going to be paying the toll for that for a very long time. Just to take one example that's striking to me, mammograms to check for breast cancer declined by, I think, something over 80% nationwide. What's the consequence of that? Many women who would have been diagnosed with earlier stage breast cancers now will come in with late stage breast cancers in next year. we've actually had made a lot of progress in reversing mortality for breast cancer and other cancers in the last decade. That's going to get reversed with 100% certainty as basic preventative measures, colonoscopies, mammography, have gone by the wayside because of COVID. I mean, I think I should just be clear, because of the COVID lockdowns. I think that the public health should think about all of health, not simply one disease. Public health is not just about infection control. I think that's been a major mistake that we've made all through this pandemic.
Very good. Thank you for that. Dr. Corey, could I just ask you a question or two about social media? You wrote in your testimony, I noticed, that one of the barriers to using already existing therapeutics, whatever they may be, there's an array of them, has been social media. And you say that your pages in particular have been repeatedly blocked on Facebook. I wonder if you could just elaborate on your experience with Facebook or any other social media on this topic.
Yeah. You know, I want to try to be respectful, because I think the intention is correct. The execution is unfortunately damaging, which is my guess at what the social media outlets, and in particular it's Facebook, is that they want to cut down on misinformation, right? Which is, many doctors are out there claiming X, Y, and Z work in this disease. The challenge is you're also silencing those of us who are expert, reasoned, researched, and extremely knowledgeable. And so my group, our Facebook page, and again, I repeat, we are some of the most highly published physicians in our specialty. We've spent, decades in academic medicine. We're not just some random doctor, but our group, every time we mention ivermectin, we've been put in Facebook jail. Currently, as of this moment, our Facebook page is shut down to the point where we cannot post anything. And we've asked the senator for help in that, because we're trying to disseminate expert opinion, heavily researched insights into the therapeutics of this disease, and we are unable to do that on social media.
What reason, Dr. Corey, what reason have they given, if any, for putting you in Facebook jail?
I don't know that we've gotten specific reasons, but the best that we can tell is that we were mentioning ivermectin. So any claims to a simple solution, and by the way, I'm going to stand by my professional reputation, my decades in medicine, and I'm going to tell you that I believe, not only I believe, but my group of doctors, and there's at least 9 of us who co-authored this manuscript, we are telling the world this is the solution to COVID-19 and it can be implemented rapidly. However, social media does not want to hear that from doctors. And I don't blame them, because otherwise you're going to have doctors coming along and saying, I don't know, soda water, or this is the next solution. So I understand the intent. However, I just wish some credibility would be applied to us, and I don't know how to solve that answer, because I do think misinformation is a problem. It is a deep and significant problem in this pandemic. However, we are not propagators of misinformation.
Is Facebook staffed with expert epidemiologists and infectious disease researchers, to your knowledge?
Not to my knowledge, certainly not.
No. I mean, should Facebook be the arbiter of what counts as medical research, in your opinion?
Of course, I don't think that they should be the arbiters, but I'm trying to be fair, and I do think their intent is to protect people from misinformation. However, they are also blocking good information. It's a very hard filter to put on, and I can understand their challenge. I just wish they did better at it.
Right. Well, thank you, Dr. Corey, thank you for your work, and thank you for sharing that. Unfortunately, this is a pattern that we see with Facebook and the other social media giants, which have now decided that they will be the arbiters of all information, news, journalism, and the rest in the United States, and that they will determine what counts as accurate, reliable news, research, and everything else, despite usually having zero expertise in any of these areas. And by the way, with zero desire for the American public that they should be deciding what we read, what we consume, what we learn about, what we share. It's really unbelievable. Mr. Chairman, thank you very much for holding this hearing.